brain healing exercises. First one I'd like to talk about is the no-no eye movement. The no-no eye movement is so amazing. It does 3 different things for you. The first thing is that when you do the no-no eye movement, it immediately starts producing serotonin in your brain. Serotonin's a neurotransmitter in your brain that really controls happiness, long-term contentment, feeling good. And you could think about depression and serotonin as being on a teeter-totter. So the more serotonin you have, the less depression you have. The more serotonin you have, just the more happiness and contentment you feel. So that's something we could all use. The second great thing about serotonin is it's the #1 painkiller in your body. It's produced in the brain, travels down the spinal cord, calming and depressing pain. So if you're in pain, the first thing I want you to think about is, oh, I need to do my no-no exercises, which I'll show you in a sec. The third thing the no-no exercises do are they increase horizontal stability. So if I've assigned this exercise to you, it's probably because you're having a hard time balancing, or during our neurological exam you were falling over or tipping a lot. Doing this exercise will help increase your stability on the horizontal plane. All right, here's how to do the exercise. You're going to hold your thumb up at eye level comfortably. You can rest your elbow on your body. And you're going to hold your thumb still. You're looking at your thumbnail the whole time. And then what you're going to do is just move your head back and forth like you're saying no. So over, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. After you do 10 of those, you're going to close your eyes, take a deep breath, and just rest for 10 seconds. Then you're going to open your eyes and do another set. Now, when you move your head back and forth, you only have to cross the midline. So it's a teeny tiny movement. We're not doing this, just a teeny tiny back and forth. Okay? So you do that 10 times with a 10-second rest in between. You're going to repeat that 4 times. Okay? And then the second set is, this time your head stays still and your thumb is going to move back and forth. 3, 4, 5, 6, 7, 8, 9, 10. Again, your eyes are following your thumbnail. And you're going to close your eyes. Take a deep breath and just rest. The reason the pause and resting for 10 seconds is so important is that if I've assigned this to you, it's because those pathways in your brain are not working well right now. And even though it seems like we're doing almost nothing by just moving this tiny, tiny movement, you're actually pushing some pathways in your brain very hard. And we want them to get stronger, but not to crash and burn. And if you do too much, you can crash and burn. And so that's why we take that pause in between each set. How would you know if you might be crashing and burning? If all of a sudden you break out in a sweat and get really hot, that would be a signal that you've reached your limit. Another signal would be all of a sudden you feel dizzy or nauseous, or all of a sudden you just feel exhausted, like the bottom just fell out. If any of those things happen, just stop doing the exercise and just sit there and breathe and rest for a minute, and don't do another set of the exercises until your next assigned time. So sometimes you'll be doing this 3 times a day, 4 times a day, 5 times a day, just depending on your situation. You would just not do any more until your next exercise time.